We're restoring integrity to medicine, restoring faith in public health, and we are restoring balance to the lives of millions of women who have been ignored for too long. And that's what it means to make America healthy again.
Health and Human Services Secretary Robert F. Kennedy announcing the removal of long-standing black box warning for many hormone replacement therapies. The shift comes as newer evidence shows that the risks are far lower for healthy women in their 40s and 50s who start treatment earlier in menopause. Let's bring in Dr. Mary Dolan from the Emory School of Medicine to help us cut through the headlines and understand what it really means for these women. Welcome to the show.
Thank you, and thank you for covering this information.
Absolutely.
That's so important for so many women.
Absolutely. Doc, in your view, why is this such a significant shift in women in midlife?
Well, this is a small step forward because there's been so much fear surrounding the use of hormones and breast cancer.
What's the biggest misconception when it comes to women and still have about hormone replacement therapy?
Well, the biggest misconception, I think, is that it's the fountain of youth. So it will not stop aging, but it can help in healthier aging. So women are living longer now, and you may spend up to 30 or 40% of your life after menopause. So we've got to start thinking about how to live a healthy life during that time. And there's lots of changes that happen at menopause that affect the heart and the bones and other systems. So it's not just about, hot flashes.
So what's the first question a woman should ask their provider at that first menopause visit?
Are you menopause certified?
Good question.
Have you had special training and interest? Women can go to menopause.org and search for providers that are menopause certified. Because of this study and its publication in 2002, there's 20 plus years of providers who have not been educated on hormone use, and there's been a lot of fear. So I think that it's important to find a provider that has really focused in on treatment of midlife and menopausal women in order to get kind of a review of your options. And I'm not saying hormones are for everybody, but women, when they know their options, they can make great decisions.
Yeah. When you're talking to patients, what risks do you still flag, and how do you help them understand the real numbers rather than fear?
Well, I think that it still is kind of an individual conversation depending upon the person's past history and what their goals are. So I think it really is individualized in terms of when we talk about risks. There are certain risks where we wouldn't consider hormones as an option, like if they've had an estrogen sensitive cancer, if they have bleeding that's, from unknown etiology, if they've had a history of blood clot, stroke, uncontrolled hypertension. There's still a lot of things we like to try to optimize their existing health in terms of talking about the options. But we have a lot more options now, not just hormones, for a lot of the menopausal symptoms. Okay,
so we got about 30 seconds left. Should more women be considering hormone replacement therapy now that the warning has been taken off, or is it still a case-by-case decision?
I think they should be considering speaking to a provider that's menopause certified that can help them know about their options and make the right choices. And I do want to put in a plug for the use of vaginal hormone therapy, which is safe for symptoms that are associated with, vaginal atrophy and thinning.
All right. Dr. Dolan, thanks so much for joining us. Thanks so much for your insight.
Thank you for, exposing this, and really appreciate the time.
Not a problem. Take care.